by next year instead of 2024, which was the projection when the president first took office. Another piece of news today, we heard the president, of course, announce today that $15 billion in child tax credit payments were distributed to tens of millions of families, covering 60 million children. Working families will receive these payments on the 15th of every single month for the next year, thanks to the American Rescue Plan. 86% of American families will receive their payment by direct deposit. It will show up in their bank accounts as Child CTC. Others will receive their check in the mail today or in the next few days. And just as a reminder, the American Rescue Plan is providing the largest ever child tax credit, and this is a historic increase that will provide middle-class families with critical tax relief, and many project it will help cut the child poverty rate in half. I have a little update for all of you on ransomware as well as vaccines, and then we'll get to your questions. In April, the President directed agencies to take aggressive action to counter the ransomware threat at home and abroad. We have coordinated these efforts, regularly convening an interagency task force that drives coordinated whole-of-government action to counter ransomware. Participation spans the whole government, including law enforcement, the intelligence community, center risk management agencies, regulators, and other national security agencies. Today, as a part of our ongoing ransomware efforts, the Department of Homeland Security, Department of Justice, Treasury, and State announced new resources and initiatives to protect American businesses and communities from ransomware attacks. Those include the Department of Homeland Security and the Department of Justice launched StopRansomware.gov, a coordinated federal government one-stop resource for public and private sector organizations to reduce their risk of ransomware attacks. The Department of Treasury announced a FinCEN exchange on ransomware to discuss efforts by the public and private sectors to increase targeted information sharing and analysis and pursue criminal actors and networks that engage in such attacks. And the Department of State announced it will offer up to $10 million in rewards for information leading to the identification or location of any person engaged in state-sponsored malicious cyber activities. This is a part of our ongoing efforts and our ongoing work of our interagency process that is a newer initiative in this administration. Finally, last night, Haiti received 500,000 doses of COVID-19 Moderna vaccines donated by the United States through the COVAX facility, and we will send in a significant amount of additional doses to Haiti soon in consultation with local health authorities. The embassy in Haiti has worked closely with Haitian Health Ministry, Pan American Health Organization, and UNICEF to ensure that these vaccines arrive safely and securely, and that they are also distributed equitably and without interference to the people who need them most. We remain, of course, a partner of the Haitian people in building a more stable and secure Haiti, including in its fight against COVID-19. Go ahead, Alex.
Thanks, Jen. Can you talk a little bit more about this request for tech companies to be more aggressive in policing misinformation? Has the administration been in touch with any of these companies, and are there any actions that the federal government can take to ensure their cooperation? Because we've seen from the start there's not a lot of action on some of these platforms.
Sure. Well, first, we are in regular touch with these social media platforms, and those engagements typically happen through members of our senior staff, but also members of our COVID-19 team. Given, as Dr. Murthy conveyed, this is a big issue of misinformation, specifically on the pandemic. In terms of actions, Alex, that we have taken, or we're working to take, I should say, from the federal government, we've increased disinformation research and tracking within the Surgeon General's office. We're flagging problematic posts for Facebook that spread disinformation. We're working with doctors and medical professionals to connect to connected medical experts.
The U.S. government is censoring
who are popular with their audiences with accurate information and boost trusted content. So we're helping to get trusted content out there. We also created the COVID Community Corps to get factual information into the hands of local messengers. And we're also investing, as you all have seen, in the president's, the vice president's, and Dr. Fauci's time in meeting with influencers who also have large reaches to a lot of these target audiences who can spread and share accurate information. You saw an example of that yesterday. I believe that video will be out tomorrow. I think that was your question, Steve, yesterday, the full follow-up there. There are also proposed changes that we have made to social media platforms, including Facebook, and those specifically are 4 key steps. One, that they measure and publicly share the impact of misinformation on their platform. Facebook should provide publicly and transparently data on the reach of COVID vaccine misinformation, not just engagement, but the reach of the misinformation and the audience that it's reaching. That will help us ensure we're getting accurate information to people. This should be provided not just to researchers, but to the public, so that the public knows and understands what is accurate and inaccurate. Second, that we have proposed that they create a robust enforcement strategy